SCHEUERMAN'S disease is a spinal disorder. Look at this picture, shows that spine, normal vertebrae with SCHEUERMAN'S disease, less curvature and more curved, bridge shaped. Look at this. CT findings. X-ray and MRI findings. Look at this. Detail going on. Introduction. SCHEUERMAN'S disease, also known as SCHEUERMAN'S kyphosis, is a structural spinal disorder that primarily affects adolescents during their growth spurts. It is characterized by an excessive rigid curvature of the thoracic or thoracolumbar spine. Unlike postural kyphosis, which is flexible and correctable with posterior embowelment, SCHEUERMAN'S kyphosis is structural, often requiring medical intervention. The condition can impact physical appearance, posture, and in severe cases, respiratory or neurological functions. Etymology. The term SCHEUERMAN'S disease is named after Holger Werfel SCHEUERMANN, a Danish radiologist who first described the condition in 1920. The word disease is derived from Old French disease, meaning discomfort, emphasizing the structural and functional spinal abnormalities associated with the disorder. A definition. SCHEUERMAN'S disease is defined as a deformity of the spine where at least 3 adjacent vertebrae are wedged by a minimum of 5 degrees, resulting in kyphosis. It is caused by abnormal growth of the vertebral end plates, leading to irregular vertebral shapes and a pronounced spinal curve. Types. 1. Thoracic kyphosis involves the thoracic spine, most common type. 2. Thoracolumbar kyphosis affects the thoracolumbar region of the spine, less common. Causes. 1. Genetic predisposition. The disease runs in families, suggesting a genetic link. 2. Mechanical stress. Mechanical stress may play a role in the severity of disease. 3. Damage to the growth areas of the vertebrae. Damage to the growth area of the vertebrae during adolescence may lead to abnormal bone growth. 4. Disrupted blood supply. The blood supplies to the vertebrae may be disrupted, affecting their growth. 5. Muscle abnormalities. Muscle abnormalities may be a possible cause. Risk factors. 1. Age. Most commonly diagnosed in the adolescents aged 10 to 16 years. 2. Gender. Slightly more prevalent in males. 3. Family history. Increased risk if family members have had the disease. 4. High intensity physical activity. Activities that exert repetitive stress on the spine. Complications. 1. Chronic back pain. 2. Reduced spinal mobility. 3. Cosmetic concerns leading to psychological issues. 4. Severe hypoxia may cause A. Respiratory difficulties, B. Compression of spinal cord or nerves. Pathophysiology. 1. Growth plate abnormality, irregular ossification of the vertebral end plates. 2. Vertebral wedges leading to hyphotic deformity. 3. Squamous nodules, herniation of disc material into the vertebral body. 4. Structural rigidity, degenerated flexibility in the affected spinal segments. Pathophysiology of SCHEUERMAN'S disease, step by step. 1. Genetic and developmental predisposition. Genetic factors, growth related issues. 2. Impaired vertebral end plate development. 3. Uneven vertebral growth. 4. Increased thoracic hypoxia. 5. Mechanical and structural changes. Intravertebral disc degeneration. Changes in spinal biomechanics. 6. Secondary musculoskeletal effects. Muscle imbalance, ligamentous changes. 7. Pain and functional limitations. 8. Progression and complications. Without treatment, progressive hyphoxia can lead to A. Chronic pain, B. Neurological defects, C. Postural deformity, and psychological distress. Signs and symptoms. 1. Rounded upper back. 2. Pain in the thoracic or thoracolumbar spine, especially after prolonged activities. 3. Fatigue. 4. Reduced range of motion in the spine. 5. Cosmetic concerns. 6. Severe cases. Neurological symptoms. Rare. Difficulty breathing due to spinal rigidity. Diagnosis. 1. Physical examination. Observation of posture. 2. Assessment of spinal flexibility. 3. Imaging studies. A. X-rays to detect vertebral bridging and curvature. B. MRI CT for detailed visualization of the spine and associated abnormalities. 4. Measurement of hypotic angle using the Cope method. Nursing diagnosis. 1. Impaired physical mobility related to spinal deformity. 2. Chronic pain related to musculoskeletal abnormalities. 3. Disturbed body image related to spinal curvature. 4. Risk for ineffective breathing pattern related to severe hypoxia. 5. Knowledge deficit regarding disease management. Management. First, medical management. 1. Observation and monitoring for mild cases. 2. Physical therapy. A. Exercise to strengthen the back and core muscles. B. Stretching exercises to improve flexibility. 3. Bracing, commonly used for growing adolescents with significant curvature. 4. Pain management, NSAIDs to pain relief. 5. Surgical intervention reserved for severe cases with hypoxia more than 70 degrees or neurological involvement. Procedures like spinal fusion may be performed. Nursing management. 1. Educate the patient and family about the disease and treatment options. To encourage adherence to prescribed physical therapy and brace use. 3. Provide emotional support to address body image concerns. 4. Monitor for complications like respiratory difficulties. 5. Advocate for regular follow-up with the healthcare team. Treatment options. 1. Non-surgical. A. Bracing and physiotherapy. B. Pain management with medications. 2. Surgical spinal fusion. B. Vertebral osteostomy for severe cases. Psychosocial impacts. 1. Self-esteem issues. Visible deformity may affect confidence. 2. Social withdrawal adolescents may avoid social activities. 3. Anxiety and depression due to chronic pain or altered body image. 4. Impact on academic performance. Pain and discomfort may hinder focus. 5. Family dynamics, increased caregiving responsibilities. Psychosocial medicine. 1. Cognitive behavioral therapy CBT. 2. Pain management counseling. 3. Support groups or peer counseling. 4. Mindfulness based stress reduction. 5. Family therapy and education. Prevention. 1. Encourage good posture during growth years. To promote physical activity to strengthen core and back muscles. 3. Educate about ergonomics during study or work. 4. Regular screening in adolescents with a family history of spinal disorders. 5. Early intervention in postural abnormalities. In conclusion, SCHEUERMAN'S disease is a significant spinal disorder that can impact the physical, emotional, and social well-being of adolescents. Early diagnosis and a multidisciplinary approach to treatment are crucial for minimizing complications and improving quality of life. Education, prevention, and supportive care play vital roles in managing the disease effectively. Thank you. Have a nice day.